So guys, good evening. Here there is cool and the winter. I'm going to talk about the gastrointestinal related problem. One is the acid reflux. What is acid reflux? The organ are involved in here is the stomach and the esophagus. There is the food pipe which is connected mouth to the stomach. What actually happens there is if the acid increase in the stomach or the not increase even the acid move from the stomach to the esophagus is the upper lining, there is the here exactly, and if it is raised the sphincter called a gastroesophageal sphincter, it is the lower esophageal sphincter. First is the here and second is the here. So the gastroesophageal sphincter is a control of the black flow of the acid. If the gastroesophageal sphincter may not the close, it is like the door of the two chambers. If the door is open, then the chambers from that one chamber from the it is the stomach and second is the esophagus, then the acid from the chambers to move the upward, that is another chamber going, that is the esophagus. If the door is open, if the acid reflux that the sphincter is not working properly or having the often may cause due to the overeating, if we eat more or if we don't eat much, or the irregular posture of our or the lifestyle, if we change the lifestyle sudden, that impact on the this gastroesophageal reflex and the acid, that the flow of the acid to the flow here. And then what the persons are do, they lie on the floor due to the because there is a heartburn and the pain of the chest. But most people are thinking like the heart, there is a heart problem, but often notice that it is not a heart, it is like the gastric esophageal reflex. Often the people lie on there, but the gravity doesn't work here. There is no role of gravity because of the stomach and because of the movements of the stomach, and the esophagus is completely depend on the peristalsis movement. So the acid reflex on the upward side and there is a heartburn. What are the causes of the main? I told you there is a obesity or the one time it happens, it is really like a normal, but if this happens regularly and very often, then you have to take the notice that the gastroesophageal reflex disease may cause, and the disease is very means it may damage over the esophagus cells and the lining of the hole, because it is very important. There is a huge inflammation may cause here, and the ulcer may form, or the gastroesophageal cancer may be formed, maybe even the 10% of the population is facing the gastroesophageal reflex, that is it is due to the more the heartburn and it is paining, but it is the stomach, the acid moving to the esophagus. I have discussed the treatments of this is changing the lifestyle and eating the enough food as we need, not even the greater food or not even the less food. Actually eating the like the punctuality, eating the earlier, the late night waking. The gastroesophageal disorder mainly happens in the late night actually, and the treatment is the antacids. What happen, and if you take the antacids, so it may be antacids are lowers the acid production and we get relief. But the more often taking the antacid, what cause there is no effect on the stomach, because the antacid just left in earlier from the stomach, and again the acid rises and you feel the increase, there is a reflex. So antacids doesn't work if you taking the often eat. There is another treatment, that is the proton inhibitor blocker. What is the proton inhibitor blocker? It blocks the three ways of the acid production pumps and you get relief. There is another, that is the histamine blocker. The more than 55% relief due to the histamine blocker. There are the ways the surgery you may have, the endoscopic surgery. What is the endoscopic? There is it is the surgery if you have the major problem not controlled by the medications and not controlled by these inhibitors, and there is a more often due to the obesity and due to your the changing the lifestyle, then you may have go towards the surgery. What is surgery? There are the surgery like endoscopy. There is a tube, have the camera that passed from the surgeon passed from the esophagus and see the stomach and go to the stomach towards, and there is a swing machine like they transplant here that works the acid reflux control in the stomach. So the another surgery is happen, they wrapped the upper part of the stomach. If they wrap the upper part of the stomach, that acts like the gastroesophageal sphincter. If the gastroesophageal sphincter is not working properly, then they wrapped here and that works like that. So how the modern medications like work, and how the surgeries works on the gastroesophageal reflux disease, and how this the physiological happen this way. So thank you for all the listening, and please share this content, because there are the no views, minimum views. I think there is no views. So okay, thank you.